From KPRC, you're watching Local 2 News at 10.
Local 2 is committed to breast cancer awareness, and in our month-long series, Think Pink, we have found that there is no question that we've come a long way in the breast cancer treatments.
Lumpectomies have replaced mastectomies for many women when it comes to catching tumors in the early stages.
But now we found a new trial at MD Anderson showing us a treatment of the future, so to speak, where breast cancer caught early could be even much easier to remove.
Cancer plays to win, and we're all marching to the same drummer, survival.
Patricia Cochran is grateful for her life, but admits the loss of her breasts is a hard pill to swallow.
It was very difficult when I first looked at it after the mastectomy. I almost fainted.
The idea of a future without lumpectomies and mastectomies was in Cochran's mind when she agreed to play guinea pig.
Something that my daughter told me not to tell you. I've been an armchair doctor for 45 years. So to me, it just fit so well.
What fit is an MD Anderson investigation into a cutting-edge idea, injecting a probe inside the center of a breast tumor and basically dropping the temperature.
Liquid nitrogen flows through the tubing, and that's how we cool the probe until it's a very cold temperature, and that's what freezes the tumor inside the breast.
Dr. Rosa Wong says cryoablation has been used in other cancers, but it's a first here.
I think it's it's a novel technique to treat breast cancer.
Novel and a little bit sci-fi to watch.
You will see the ice bore developing around the probe exactly as it would inside the breast. We have shown that it does work. It kills the tumor.
For now, the investigation is very selective, and even after the tumor is frozen, the cancer killed, a lumpectomy or mastectomy is still required as a cautious measure.
Right now, we're only going to be able to treat patients with small breast cancers. We have to make sure on an MRI that it's the only tumor in the breast. And so we're very picky about which patients are going to be eligible for this protocol.
You know, they asked me, they said they thought it would be cold.
Cochran says that she was too numb to notice. What did come through loud and clear,
It just didn't hurt.
killing the tumor is one thing, but what doctors are really excited about here is something that they saw in the animal testing.
It suggests that the cryoablation process itself might actually be stimulating the immune system, which may help fight cancer cells and reduce the chance of cancer coming back in the future, and also reducing the chance that cancer could spread somewhere else.
If you asked me what do I think about it, I think it's close to a miracle.
Now, there are only 20 hospitals in the country running this clinical trial. MD Anderson is the only one here in Texas. And you can find a list of the other hospitals